The human body is about 60% water, and this is a good thing until water ends up going where it's not supposed to be. Let's get into it. What's up, everyone? Mike Muellner here. I'm an internal medicine doctor from Los Angeles, California, and today we're going to talk about what happens when fluid collects in abnormal places. So what do I mean by abnormal places? So there are places in the body where fluid should be. When you drink fluid, it'll go into your mouth, down the esophagus, into the stomach, the digestive tract, then it gets absorbed into the bloodstream, where it eventually finds its way to the kidneys, where it's filtered out down the ureters into the bladder, and then outside of the body. But sometimes in diseased states, this normal flow of fluid gets disrupted. If you get fluid collecting in the lungs, we call this a pleural effusion. If fluid collects around the heart, this is a pericardial effusion. Fluid can also find its way into the abdominal cavity. We call this ascites. And fluid can even find its way into joints. In all these cases, it's very abnormal. And a whole slew of different diseases can cause this. So let's talk about the lungs first. So in the lungs, if you get fluid, this is a pleural effusion. Lots of different things can cause this. It can be from something going on with the lungs themselves, such as pneumonia. Infections very commonly lead to pleural effusions. Thankfully, in that case, when you treat the infection, the fluid usually won't come back because the underlying reason for having the fluid there in the first place has been taken care of. But if the fluid is from a tumor or mass in the lung, this could be cancer, then you can have what's called a malignant pleural effusion. This is something that can't always be treated, and so these effusions tend to be recurrent. Some people even end up having to get a drain left in place for the long term to drain fluid as it reaccumulates. Now, sometimes what needs to be done to get rid of fluid or to run tests on it is a thoracentesis. So this is where a doctor takes a very long needle that has a catheter over it. So a catheter is just a little rubber-looking tube that goes over the needle. So the doctor will then, using ultrasound, find a good fluid pocket on the back and then insert the needle, of course, numbing the area first, sterilizing the area. But then once that's all set, the needle goes in and then the catheter moves over the needle where it's moved into the pleural space or the space around the lung. This then allows the effusion to drain through the catheter into a bag. Oftentimes, doctors can remove 500 cc's, 700 cc's, even as much as a liter of fluid can be removed from around the lung. And this can really provide a lot of symptomatic relief. It's usually not the most comfortable thing in the world. As the lung re-expands, the people typically will start coughing. They might feel a little more shorter breath initially, but once all that pressure is relieved, usually people can breathe a whole lot better. So then once we take the fluid out, we'll then run a few tests on it. And the first test we always get is we look for lactate dehydrogenase and protein levels. And from that, we can do calculations to form, to figure out Light's criteria. So this is how we can determine if the effusion is exudative or transudative. If it's exudative, then we know it's something going on with the lung itself. This could be infection, it could be malignancy. But if it's transudative, then that means that the fluid is more likely just accumulating in the lung from elsewhere in the body. Common reasons for this would be heart failure, kidney failure, liver failure. It's something going on systemically or elsewhere in the body, not the lung itself. So now, once we've made our diagnosis, we know how to treat it. If it's a pneumonia, we'll give antibiotics. If it's from congestive heart failure, we'll direct our attention to the heart and treat the underlying issue, which is the heart failure. And in doing so, that's how we can address the fluid when it accumulates in the lungs. Now, the lungs aren't the only place in the body that can end up having too much water. The space around the heart is another example. When this happens, we call this a pericardial effusion. And if it's small, it might not cause any issues. You might just find it on an ultrasound or echocardiogram. But the problem is that if the fluid really accumulates a lot, it can expand, and this is a finite amount of space. And so eventually what happens is the liquid expands to the point where there's nowhere else it can go, and then you actually get pressure building up on the heart itself. We call this cardiac tamponade. And this then can impede the function of the heart, even leading to cardiac arrest. So when this happens, it's an emergency. A doctor and hopefully a trained cardiologist here will put in a needle to drain the fluid and help relieve the pressure. Now I say hopefully a trained cardiologist because that's not always the case. In the event of a cardiac arrest, if someone is in the middle of a code blue, Sometimes doctors, critical care doctors, or technically even a hospital medicine doctor like myself could make an attempt at a pericardial centesis with a needle. And I'll never forget it. One time I had a critical care doctor back when I was in training who had suspected cardiac tamponade in somebody who had cardiac arrest. They lost a pulse. And that doctor then said, you know what, this is somebody who is already dead. This is someone who has no pulse. You can't hurt this patient. All you can do is help. And so that's when very aggressive things like using a needle to go right around the space around the heart to try to drain fluid can be a reasonable thing to attempt. Now, when we talked about water in the inappropriate places in the lungs, we mentioned things like infection or cancer. Similar issue with the heart for this pericardial effusion. It can be from lymphoma is one thing that can do it. It can also be the result of trauma. So lots of different things can cause that. Now let's make our way outside of the chest into the abdomen. So the abdomen is a very busy place. There's a lot going on there. You got all your digestive organs, the pancreas, the small intestines, large intestines, the liver, gallbladder. You got your kidneys there in the back. And there's a lot going on, and certainly a lot of liquid running through there in the blood and also in the digestive tract and into the bloodstream that leads to the kidneys. But all that liquid should be contained. If the liquid is just free flowing randomly in what we call the peritoneal space, that's a real problem. We call this ascites. And it's not at all uncommon for internal medicine doctors like myself to have to drain fluid from the abdomen. This is a paracentesis, and it's the same idea as the thoracentesis. You use an ultrasound, find a good pocket, go in with a needle. With this one, you can actually just use a large spinal needle, but most often we'll use a needle and then put the catheter over the needle to drain fluid out. And similar situation, we then run tests to try to figure out if there's anything else going on like infection or cancer. But this one is quite satisfying because you can sometimes remove 4, 5, 6, 7, 8, 9 liters of fluid, which can really make a world of difference as far as providing relief for people suffering with ascites. Sometimes I've seen people who look like they're 9 months pregnant, and then after the procedure, the belly goes back down to almost being flat. And you can really have a lot of instant relief with that procedure. Okay, so we've already talked about how fluid can accumulate in the lungs, around the heart, in the abdomen. But that's not all. Other organs can be affected by this too. For example, the kidneys, if you have an obstruction in the flow of urine, for example, with prostate hyperplasia, if the prostate in men gets to be very enlarged, this can impede the flow of urine from the bladder and can actually back up into the ureters, the tubes that lead from the bladder into the kidneys, and you can get backflow of urine into the kidneys. This causes hydronephrosis. So yet another place where fluid can accumulate abnormally. All right, so this was a pretty complicated video. The point of this wasn't to go into incredible detail in any of these diseases, but rather just to provide a general overview about what can happen when fluid ends up where it's not supposed to be in the body. And I do realize I've said the word fluid about 1,000 times, so if you've stuck with me this far, I appreciate it. And as always, we got another video here you can check out. And if you like medical content like this, go ahead and hit the subscribe button. And I'll see you guys next time.